Hello, this is Christian Salas, and this is my signature assignment for my research and evidence-based practice class. So the topic that I decided to talk about as my clinical problem is that of multi-occupancy hospital rooms. And one of the main reasons that I chose to talk about this is because I actually work in a unit that still has shared rooms, and it's a medical surgical unit, and I've personally been able to witness the pros and the cons that come with having shared rooms. So, shared rooms are actually still pretty common throughout the United States. They do appear to be decreasing, and this is based on patient satisfaction, on infection control measures, privacy, and also due to the recommendation of the Health Guidelines Revision Community. In 2006, they recommended that all hospitals switch over to private rooms, and this is due to their concerns on the patient's safety and privacy. So, one of the biggest arguments that come with shared rooms is contagion. So, this is really common. Um, having shared rooms, you have two to three patients in one room, and sometimes the nurse will don her gloves. She'll go see a patient, be distracted by something, by her workload, by talking, and she'll head over to the next patient without changing her gloves. So what'll happen now is they're increasing the other patient's chance of developing an infection, especially if their first patient has one that may not be detected yet, that they completely forgot about. This happens often. It also happens with doctors, nurses, and techs. So, say you're in with patient one, and then patient two starts screaming, you hear them fall, they're crying, they're in distress. You're gonna run over there to check on them, so without washing your hands, without putting gloves on, without changing your gloves. So now you're putting them at risk again. So this is really common, and in fact, the CDC states that approximately 78,000 Americans die due to hospital-acquired infections each year, and I believe it's 1 in 3 patients will develop an hospital-acquired infection during their hospital stay. That is a big number, and I shared rooms increase this risk. So this is one of the biggest problems. So another problem is privacy. So this one's a little trickier because HIPAA comes into play into this one, and this is because you can be discussing a patient's health, their personal information with them, something they want to keep private. You might be discussing it with them, but their next door neighbor can hear. No matter how low you try to speak, they're going to hear, because in reality, they're only being separated by a very thin curtain. The beds are really close together. You can hear everything, especially on my unit. Even the walls are paper thin. You can hear everything. So this is very bad, because this patient may not want anyone to know this, but their neighbor's going to hear it, and vice versa. They're going to hear what's going on with their neighbor, and it's not preventing any of this information from not being heard. So, and then this might embarrass the patients. I've actually been in a situation where a patient wasn't able to walk to the bathroom, and they had to use a commode. They were very embarrassed because they had a neighbor. Um, they were embarrassed to the point where they were crying, and it just feels awful seeing them go through this, but especially when this is a natural body, function, is elimination. And they couldn't even do that without crying and feeling uncomfortable. And afterwards, they were spraying the odor eliminator all over the room, and it's just terrible. And this is bad because they were holding it in because they were just too embarrassed to go. So this poses other health concerns, health problems, and then it bothers the other patient as well. So it's just, there's no privacy in these rooms. It's very difficult to maintain. And there's actually been a study that was conducted by Wyatt Erlander, Fazali Ali, and Catherine Chang. And this study took 162 participants, and it was determined that 92% of these reported adequate privacy in private rooms, and then they have also been in shared rooms, and they reported adequate privacy at 53% for shared rooms. So it's evident that it's inadequate, that privacy is inadequate in these shared rooms. I personally would prefer a private room, and I'm sure a lot of people would as well. I mean, you're not comfortable with the idea of feeling sick and then having to sleep with a stranger and then listening to your problems. It just adds more difficulty to your health, to how you're feeling. Another problem is sleep. So sleep has actually been proven to help promote healing, and it's crucial for patients in hospitals to be well rested. Hospitals have quiet hours, and this is to help promote healing. So there was a study performed by Tracy Smith, who's a nutritional scientist that works for the Army Research Institute of Environmental Medicine, and she found that wounds heal faster when you receive adequate sleep. So for the study, she took 3 groups of 20 participants, and she gave them small wounds on their forearm. So one of these groups was allowed to sleep 7 to 9 hours a night, and the other 2 groups were only allowed to sleep 2 hours per night for 3 days. So these other 2 groups, one was given a protein drink, and the other one was given a placebo that tasted the same but had no nutritional value. So out of these 3 groups, the one that healed the fastest was the first group, which was getting 7 to 9 hours of sleep. Their wounds healed in 4.2 days, and the wounds of the other ones getting only 2 hours per night were healed in 5 days. Even the one with the nutritional drink and the placebo, they still healed in 5 days. So this is proof that wounds will heal faster if you're getting adequate sleep. And this can be difficult if you're having a shared room. This is because your roommate might want to have the lights on. They might have the TV on too loud. They might always be on the call light calling for help, waking up to go to the bathroom. There might even be disagreements on the temperature of the room. It's either too hot or too cold, and it's really hard to try to adjust it so that both are comfortable. So there's a lot of lack of sleep in these hospital rooms. And then another problem is patient satisfaction. The ratings for our unit are lower than the other ones, and the other units have private rooms. And a lot of the patient comments have to do with this, is that they have shared rooms. There's nothing we can do about it, but except try to change the layout, and hopefully this will help improve the ratings. So one of the changes that can be made is changing the whole layout of the unit. And I know this sounds unrealistic, especially since it's going to be a lot of money, but my hospital is planning a remodel. So me and a bunch of other nurses have already talked to the director about this, about private rooms, about making the rooms smaller so that they're private, but adding more rooms so that we can still fit the same amount of patients or close to the same amount of patients, so that the hospital's not really losing money. And this will bring up patient satisfaction. And during this time, we compared the numbers, the satisfaction ratings of other units in the hospital, even other hospitals that belong to the same company, how patient satisfaction increases, how infection decreases. And private rooms are actually cheaper to operate than shared rooms. And this is because for a private room, you could just assign a patient to any patient, no matter who they are, what they're suffering from, they can go into a private room. But when you have shared rooms, you have to consider their age, their gender, their diagnosis, and this is difficult. Sometimes it takes a while to fill up the rooms. Sometimes it's hard for a patient to get a room. So if you have a private room, you can just get patients in quicker and not have to worry about these other factors. And numbers play a big part in this. You have to give numbers in order to get your point across, and this is because numbers are easier for people to follow, especially statistics. You know, statistics speak. They're gonna help get your point across, and they have. I mean, even now, 78,000 deaths related to infection. That's a big number. That's a lot of people dying for something that could have been prevented. And then ethical considerations to be taken. Their ethics does play a part in this, and this is because you are jeopardizing the patient's integrity, their value, fairness, and their rights when you are having a shared room. And this is because, as I mentioned before, there is no privacy, that you are performing procedures that are painful for them, while there's someone else that could be embarrassing for them having to go to the bathroom, having a brief on, keeping their roommate awake. These could all be embarrassing for a patient. Or if you go in and both have to go to the bathroom, who do you choose who goes first? It's very difficult. These patients deserve better, and this is why hospitals should try to implement private rooms a lot more than shared rooms, and we can slowly try to eradicate shared rooms. I'm not trying to be biased. Studies show, interviews with these patients show that they prefer private rooms and that they thrive in these rooms. This is because their risk of infection decreases, their satisfaction improves, the quality of care they are receiving improves, their privacy improves, and any ethical complications that are being encountered also improve with private rooms. So that's all I have for this video. Thank you very much for giving me an opportunity to have an extension for this class. I do apologize. I wish I could have gotten this done sooner, but I have no control over the situation. Thank you very much for the semester. I learned a lot. I truly enjoyed the class, and I hope that you have a great rest of your week, year even. Thank you so much for everything.